57 students at a single Florida university have now been diagnosed with measles, and 7 remain in quarantine. According to campus health updates from Ave Maria University in Collier County, this is the largest campus measles outbreak reported in the state in recent history. At the same time, just 200 miles north in Tallahassee, a bill called the Medical Freedom Act is advancing through the Florida Legislature that would make it easier for parents to exempt their children from school vaccination requirements. One event is unfolding in hospital beds and quarantine rooms. The other is unfolding in committee hearings and floor votes. Together, they represent the central public health tension in Florida right now. According to the Centers for Disease Control and Prevention, 910 confirmed measles cases have been reported across the United States as of February 12, 2026. Florida ranks as the third largest outbreak state in the country this year, behind South Carolina and Texas. This video examines the facts on both sides of this issue, based on data from the CDC, the Florida Department of Health, legislative records, and reporting from multiple news sources. The outbreak at Ave Maria University began in late January 2026. Ave Maria is a private Catholic university located in an unincorporated community northeast of Naples in Collier County. According to a campus health update posted by the university, nurses on campus had assessed 57 students presenting measles symptoms as of February 11th. Of those, 50 had progressed beyond the 4-day contagious period and developed natural immunity. 5 students remained in quarantine, and 2 additional students had rashes that were still being evaluated. The university established a second on-campus clinic, in addition to its existing Padre Pio campus health clinic, to manage the caseload. The Florida Department of Health in Collier County deployed nurses, doctors, and coordinators to the campus and began offering free vaccination clinics for pre-exposure and post-exposure prevention. A critical detail about this outbreak is that the university reported that approximately 90 to 98% of its student population is vaccinated against measles. This exceeds the national average and approaches the 95% threshold generally cited by public health experts as necessary for herd immunity. According to the CDC, the measles, mumps, and rubella vaccine is approximately 97% effective after 2 doses. Despite this high coverage, the outbreak occurred. Medical experts have explained that measles is exceptionally contagious. According to the CDC, if one person has measles, up to 9 out of 10 people nearby who are not protected will become infected. The virus can remain viable in the air for up to 2 hours after an infected person leaves a room. Dr. Juan Antonio Dumois, a pediatric infectious disease physician at Johns Hopkins All Children's Hospital in St. Petersburg, explained in an interview with WUSF that measles is the most contagious disease known in terms of airborne transmission. Even small gaps in immunity within a community can allow the virus to spread rapidly, particularly in dense settings like university campuses where students share classrooms, dining halls, and dormitories. The Florida Department of Health released its updated Reportable Diseases Frequency Report on February 13th, showing 66 confirmed measles cases statewide through February 7th, with 46 of those concentrated in Collier County. However, the DOH data lagged behind campus reports. By the time the state published 46 confirmed Collier County cases, the university's own clinic had already assessed 57 students. WUSF reported that the DOH updates its data weekly, creating a gap that health experts have called problematic during an active outbreak of a highly contagious disease. A day after the discrepancy became public, Ave Maria announced it would stop publishing its own running campus totals and instead defer to the DOH website for official weekly updates. Beyond Collier County, measles activity has been reported in other parts of Florida. The University of Florida in Gainesville confirmed 2 classrooms where measles exposures may have occurred, and the university said it was working with health officials on contact tracing. 2 cases were confirmed in Alachua County. In Duval County, home to Jacksonville, 4 confirmed cases and 1 additional case identified by a pediatric infectious disease specialist were reported. St. Johns County reported 1 case. St. Petersburg Catholic High School confirmed a case on February 4th. 3 students from the Ave Maria outbreak were hospitalized due to complications. The Florida measles cases are part of a broader national surge. The CDC reported 2,267 confirmed measles cases in 2025, spread across 45 states, a dramatic increase from 285 cases in 2024. In 2026, cases are accelerating. As of February 12, 910 cases had been confirmed across 24 jurisdictions. South Carolina accounted for the largest share with more than 500 cases, where at least 19 people have been hospitalized, and cases of measles-related encephalitis, or brain swelling, have been documented. The CDC reported that 95% of measles patients nationally are unvaccinated or have an unknown vaccination status, while approximately 3 to 4% of cases involved individuals who were fully vaccinated. Measles was declared eliminated in the United States in 2000, a designation that means the disease was no longer continuously transmitted within the country for 12 or more months. This status was achieved through high vaccination coverage. However, the Pan American Health Organization, an arm of the World Health Organization, is scheduled to evaluate whether the United States should retain this elimination status sometime in 2026. Multiple countries have already lost their measles elimination designations in recent years, including Canada, the United Kingdom, and 5 European nations. Medical researchers at Stanford University projected that a 15% decline in vaccination rates over 25 years would result in approximately 1 million measles cases in the United States. Against this backdrop, the Florida Legislature is considering legislation that would expand the circumstances under which parents can exempt their children from mandatory school vaccinations. Senate Bill 1756, titled the Medical Freedom Act, was filed by Republican Senator Clay Yarborough of Jacksonville. Its companion in the House is HB 917, sponsored by Republican Representative Jeff Holcomb of Spring Hill. On January 26, 2026, the Senate Health Policy Committee passed a committee substitute version of SB 1756 in a 6-4 vote. The legislation contains several provisions. First, it would require healthcare practitioners and paramedics to inform a parent or legal guardian of the risks, benefits, safety, and efficacy of specific vaccines before administering them to a minor, using materials approved by the Board of Medicine and the Board of Osteopathic Medicine. Second, it would create a new conscience-based exemption to the existing requirement that children be vaccinated before enrolling in school. Florida law currently requires children entering school to be vaccinated against polio, measles, mumps, rubella, diphtheria, tetanus, pertussis, hepatitis B, chickenpox, and meningitis. Parents can currently seek exemptions for medical reasons or religious reasons. The Medical Freedom Act would add a conscience-based exemption for parents whose objections are philosophical rather than religious. Third, the bill would limit the power of state health officers to mandate emergency vaccinations. Fourth, it would allow pharmacists to dispense ivermectin, the anti-parasitic drug that drew controversy during the COVID-19 pandemic, without a prescription. The House version, HB 917, includes similar provisions and adds language that would prohibit healthcare facilities and providers from discriminating against patients based on vaccination status. This would, for example, prevent a physician from refusing to see an unvaccinated patient. Senator Yarborough has framed the legislation as a matter of parental rights. In statements to multiple news outlets, he said parents need to be in the driver's seat with regard to their children's education, their well-being, and their health care. He said the bill does not remove any existing vaccine mandates, but provides an additional pathway for parents who have philosophical objections. He also stated that he does not believe additional exemptions lead to more cases of disease. During the Senate Health Policy Committee hearing, Republican Senator Gail Harrell of Stewart raised concerns. She proposed an amendment that would have required parents seeking an exemption to receive the same vaccine education materials that parents seeking vaccinations would receive. The amendment was voted down. Harrell warned that Florida was moving backward on a public health issue where the state had made decades of progress. The CDC data shows that Florida's kindergarten measles vaccination rate has declined from approximately 93.3% in the 2014-2015 school year to 88.8% in the 2024-2025 school year, falling below the 95% threshold generally recommended for herd immunity. Florida's Surgeon General, Dr. Joseph Ladapo, has taken a prominent public position on vaccines. He has called for the elimination of all school vaccine mandates in the state. In a September 2025 conference with Governor DeSantis, Ladapo stated that he would not tell a parent what their child should put in their body. In 2024, during a measles exposure event in Broward County, Ladapo told parents it was acceptable to send unvaccinated children to school. In January 2026, Ladapo and First Lady Casey DeSantis publicly supported mothers who reported difficulty finding pediatricians willing to treat their unvaccinated children, framing the issue as one of parental rights and medical freedom. The Florida Department of Health, under Ladapo's direction, also held a workshop in late 2025 about a proposal to remove vaccination requirements for hepatitis B, chickenpox, and Haemophilus influenzae type B. The department has stated that changes to vaccine mandates would take effect 90 days after rulemaking is finalized, and that lawmakers would make final decisions on vaccines for polio and measles. Medical professionals have responded to the legislative debate with concern. Dr. Thomas Unash, a distinguished professor emeritus at the University of South Florida, stated that parents should understand that measles is not a pleasant disease. He cited data showing that 20% of unvaccinated children who contract measles require hospitalization, and approximately 3 in every 1,000 unvaccinated children who are infected die from the disease. Dr. Payal Kohli, a medical expert appearing on First Coast News, said she supports informed consent, but warned that declining vaccination rates could have serious consequences. The CDC has reported that measles complications can include pneumonia, which occurs in about 1 in 4 unvaccinated people who get measles, and encephalitis, which occurs in approximately 1 in 1,000 cases and can lead to permanent brain damage. In South Carolina's ongoing outbreak, health officials have documented cases of measles-related encephalitis and have reported pregnant women requiring immune globulin treatment after exposure. The CDC states that measles can cause hearing loss and, in rare cases, subacute sclerosing panencephalitis, or SSPE, a fatal brain disease that can develop years after a measles infection. The national context adds another layer to the Florida situation. Robert F. Kennedy Jr., who serves as Secretary of the U.S. Department of Health and Human Services, has a documented history of questioning vaccine safety. In a social media post in 2025, Kennedy stated that the MMR vaccine is the most effective way to stop the spread of measles, but he has also publicly questioned the safety and efficacy of vaccines, contradicting decades of peer-reviewed research. At the federal level, the CDC recently revised its childhood vaccine schedule, and the FDA rejected an application for a new flu vaccine from Moderna. Pediatricians responded by issuing their own vaccine recommendations that diverged from the CDC in some areas. These federal developments have created confusion about vaccination guidance at the state level. The legislative timeline for the Medical Freedom Act remains active. SB 1756 passed the Senate Health Policy Committee on January 26 and must next pass the Appropriations Committee and the Rules Committee before reaching the full Senate floor. HB 917 is moving through House committees on a parallel track. The 2026 legislative session runs through March 13th. Both bills have companion language but are not identical. If either passes its respective chamber, it would need to pass the other chamber before going to the governor's desk. Governor DeSantis has signaled broad support for medical freedom legislation throughout his tenure. Florida currently has approximately 2.8 million children enrolled in public and private schools. According to the CDC, the state's kindergarten MMR vaccination rate of 88.8% means approximately 11.2% of entering kindergartners, or roughly 1 in 9 children, may not be fully vaccinated against measles. In counties with lower coverage rates, the percentage of unprotected children is higher. The conscience-based exemption proposed in SB 1756 would provide a new legal pathway for parents in addition to existing medical and religious exemptions, potentially lowering coverage rates further. Proponents of the Medical Freedom Act argue that the bill protects parental autonomy and does not eliminate any existing vaccine mandates. They contend that parents should have the freedom to make medical decisions for their children without government interference, and that the bill simply provides information and options. Public health officials and medical organizations counter that broadening exemptions has been consistently associated with increased disease transmission. They point to California, Maine, and New York, which eliminated non-medical exemptions in response to earlier outbreaks and subsequently saw vaccination rates increase. The American Academy of Pediatrics and the American Medical Association have long opposed non-medical vaccine exemptions on public health grounds. The situation at Ave Maria University illustrates both the limits and importance of vaccination. While the outbreak occurred in a highly vaccinated population, demonstrating that no vaccine provides 100% protection, medical experts emphasize that the severity and scope of outbreaks are dramatically worse in communities with lower vaccination rates. In South Carolina, where more than 2/3 of all cases have occurred in children ages 5 to 17, the outbreak has resulted in hospitalizations, encephalitis cases, and emergency interventions for pregnant women. As of February 16, 2026, the Ave Maria University campus remains open for normal operations, including in-person classes and religious services. The university has stated that the vast majority of its community is protected and that students who progress through the illness now have natural immunity. The Florida Department of Health continues to offer free vaccination services at its Naples and Immokalee locations. Nationally, the CDC recommends that all children receive 2 doses of the MMR vaccine, the first at 12 to 15 months of age and the second at 4 to 6 years of age. The intersection of an active measles outbreak and advancing legislation to expand vaccine exemptions has drawn national attention to Florida. The outcome of SB 1756 and HB 917 could influence vaccination policy not only in Florida, but across the country, where other states including Idaho, Louisiana, Texas, and Montana are pursuing similar legislation. The CDC continues to monitor the national measles situation and has stated that the United States may be at risk of losing its measles elimination status. Further developments are expected as more case data is released by the Florida Department of Health and as the Medical Freedom Act moves through remaining committee stops in the legislature. The decisions made in the coming weeks will have implications for the 2.8 million schoolchildren in Florida and the broader national conversation about vaccination policy, parental rights, and public health. To place this moment in historical context, measles was once one of the most common and feared childhood diseases in the United States. Before the first measles vaccine was introduced in 1963, the CDC estimates that 3 to 4 million Americans contracted measles each year. Of those, approximately 48,000 were hospitalized, 1,000 developed encephalitis, and 400 to 500 died annually. The widespread adoption of the MMR vaccine over the following decades reduced cases dramatically, leading to the official declaration of measles elimination in the United States in 2000. That year, only 86 cases were reported nationwide. The current trajectory represents a reversal of those gains. In 2024, there were 285 confirmed cases. In 2025, that number surged to 2,267 across 45 states. The 910 cases reported in the first 6 weeks of 2026 alone suggest the annual total could exceed previous years significantly. The CDC has attributed the resurgence to declining vaccination rates, international travel bringing the virus into communities with immunity gaps, and the extreme contagiousness of measles in any setting where unvaccinated or undervaccinated individuals gather. For Florida residents, there are several practical facts to be aware of. The MMR vaccine is available at pediatrician offices, county health departments, pharmacies, and community health centers throughout the state. For individuals who may have been exposed to measles, the CDC recommends contacting a healthcare provider immediately. Post-exposure prophylaxis, which can include the MMR vaccine given within 72 hours of exposure or immune globulin given within 6 days, may prevent or reduce the severity of illness. Measles symptoms typically appear 7 to 14 days after exposure and begin with high fever, cough, runny nose, and red, watery eyes. A characteristic rash develops 3 to 5 days after symptoms begin, starting on the face and spreading downward across the body. The Florida Department of Health provides vaccination records through the Florida Shots Immunization Registry. Parents who are unsure of their child's vaccination status can contact their healthcare provider or local county health department to verify records and obtain any needed doses. Adults born after 1957 who have not been vaccinated or who lack evidence of immunity may also benefit from vaccination, particularly those who work in healthcare settings, attend college, or plan to travel internationally. Further developments are expected as more case data is released by the Florida Department of Health and as the Medical Freedom Act moves through remaining committee stops in the legislature. The decisions made in the coming weeks will have implications for the 2.8 million school children in Florida and the broader national conversation about vaccination policy, parental rights, and public health. This video presents fact-based information and context. It does not provide advice or endorsements.